Hi everyone, welcome to AirSculpt TV. My name is Anita. I am here at our Elite Body Sculpture location in Denver, Colorado. And we are going to take you live to one of our procedures today. Our lovely patient Kimberly is having her dorsocervical fat pad, which is also known as the buffalo hump, which is right back on the back of the neck. We are sculpting that area for her today, and we want to take you there live. So while we're doing that, I want you guys to all think about whatever questions you have and send them to us so we can answer your questions and just get you guys all up to date on what we do here at Elite Body Sculpture. So come on in with me. Hey, welcome to our procedure room.
Hi, Kimberly.
Hello. This is Kimberly. As we mentioned, we're doing her dorsocervical fat pad, which is also known as the buffalo hump on the back of her neck. This is Dr. Zadu performing the procedure. Kimberly, how are you feeling?
I'm feeling really good, really relaxed. Like, this is the easiest thing I've ever done. So
That's awesome. So you feel relaxed, you're not in pain?
no, not at all.
Okay, great. What does it actually feel like getting the AirSculpt procedure done?
It's like a massage, like like one of those new massages that they just came out with. Yeah, and so it feels great.
So it actually feels like a massage.
Yeah.
That's amazing. That's great. Dr. Zadu, what do you have to tell us today about the procedure that we're doing?
Yeah, so Kimberly has graciously volunteered for this, and we did the back of her. We did her inner thighs first. Now we're working on what we call the buffalo hump, this bump that's been bugging her at the top of her back, lower neck. And the AirSculpt, which is a patented technology, is really ideal for this because it is a little bit fibrous fat. But the AirSculpt technology also is very gentle, so we're doing it while she's awake. We've been talking, she's been on her phone. And also then, because it's more a gentle way to take out the fat, it basically translates into a really quick recovery, much quicker than traditional means. And so it really is a superior technology. It's also safer, really, because, again, she's awake, she's not under a general anesthetic, which can have risks, and she's also moving, which means we're not going to get blood clots in the legs. And the moving also actually means I can get to the fat in different angles, and that's really a great way to get it out efficiently, thoroughly.
So does that actually help with getting better results as far as body contouring goes, that the patient is awake?
Absolutely, yes. So again, it's safer because we're not using a general anesthetic, and then also I can move her, we can position her in all different positions, and that gives me the chance to get the fat in different angles, and it's a much better way to do it.
So compared to other body contouring that you've done in your past, how does this compare, Dr. Zadu?
Well, it truly is superior. I mean, I've been doing plastic surgery for 20 years, so I've seen the whole evolution of body contouring, and this really is, I think, kind of the pinnacle of body contouring. We kind of call it the Mercedes of body contouring.
That's amazing. I mean, look at how comfortable she is. She's just laying here, relaxed, hanging out while we're talking about this. And then also, too, I wanted to point out, look at all that fat over there. We're just pulling out the fat, and Kimberly is just relaxing while we're doing it.
Like I haven't even gotten up yet, and I already feel like lighter there.
That's amazing. Kimberly, would you recommend this to your friends and family?
Oh, definitely. Yeah, for sure.
What would you say is like the best part of this?
Honestly, yeah, being awake for it. Everyone's been really nice. We've just been talking this whole time. I FaceTimed a friend, so.
So you're literally like FaceTiming while you're in here?
Yeah, I'm just, I'm just chilling.
Just chilling. That's awesome. Cool.
All right, let's see if we have any questions. So our patients want to know, what is AirSculpt?
So AirSculpt is our patented technology that we use to contour people's bodies and remove fat. Our results are absolutely amazing. You can see Dr. Zadu is performing AirSculpt procedure right now.
You can see the fat going through the tube right now.
You can see the fat going through the tube right now.
You can see the fat going through the tube right now.
You can see the fat going through the tube right now. You can see the fat going through the tube right now. You can see the fat going through the tube right now. You can see the fat going through the tube right now. You can see the fat going through the tube right now. You can see the fat going through the tube right now. You can see the fat going through the tube right now. You can see the fat going through the tube right now. You can see the fat going through the tube right now. You can see the fat going through the tube right now. You can see the fat going through the tube right now. You can see the fat going through the tube right now. You can see the fat going through the tube right now. You can see the fat going through the tube right now. You can see the fat going through the tube right now. You can see the fat going through the tube right now. You can see the fat going through the tube right now. You can see the fat going through the tube right now. You can see the fat going thro
Wow. How does it feel, Kimberly?
Yeah, it just feels like a massage, like one of those physical therapy massages. So it actually feels good.
Cool. Let's look at the fat. Have you been able to take a look at the canister and see the fat that's come out?
Oh yeah,
Are you so excited?
I am.
Yay.
Yeah, I'm very excited.
As far as our AirSculpt goes, I just also want to mention we can take that from your neck down to your ankles, and really it's body contouring, so it's really going to reshape your body and just get you results that are unlike any other.
What would you say, how long is the recovery for AirSculpt?
Honestly, recovery is very, very minimal social downtime. Everybody's body's a little bit different, but we have people that go back to work the very next day with just really little to no downtime.
You hear that, Kimberly? You gotta be ready. Dr. Zadu, what would you say about AirSculpt over other procedures in body sculpting?
Well, the trend is to be able to do minimally invasive type work and recover quicker. So, for example, another advantage that we didn't really talk about is the ability to tighten skin to a degree, and also when we incorporate our lasers. So instead of having to do, say, a tummy tuck, which is very invasive and has a really long, painful recovery, oftentimes we can get the tummy skin to tighten up after removing the fat and avoid the big operation.
Awesome. Let's see if we have more questions. How are you doing?
I'm doing great.
Yay.
I mean, just massage is
Awesome.
gonna put me to sleep.
What music were you listening to?
Oh, I chose yacht rock.
Yeah? Just jamming out to yacht rock while you're getting your buffalo hump done?
Yeah.
Awesome. All right.
So
let's
I
see.
just want to answer a couple of questions. Right now we are located in Denver, Colorado, but we have locations all over the country. So wherever you're at, go ahead and Google us and reach out, and you will find a location that's near you. And I know that we've kind of gone over this, but I want to also say again, Kimberly is totally awake, which is a huge benefit to this procedure. She's super comfortable, awake. The procedure it depends on what you're having done, how many different areas you're having done. Usually it's about 2 to 4 hours for the total time of the procedure. And again, recovery can be minimal, 24 hours, 1 or 2 days at most to get back 100%.
So one of our questions is, since we are removing the fat, are we able to then transfer it to another location?
Absolutely. And that's really what sets us apart also, is our fat transfers. Our doctors are amazing at that procedure. We do what is called an uppercut, which is a fat transfer to the breast. And then we also do what is known as a Brazilian butt lift, which is a fat transfer to the buttock area. Both have amazing results and outcomes. We have tons of happy patients who have had fat transfers done. And that again goes back to our body contouring, which is really just reshaping your body.
And question, Dr. Zadu, for Kimberly and most of our patients, would you say, do they need other procedures? Do they need to come in again? Or is this kind of one and done?
Well, for sure it's one and done in the area that we're working on. Now, it turns out that oftentimes our patients are so happy that they want another area done, but it is, yes, a one and done. And that's a big difference. This isn't multiple sessions for the same spot. You do it that day and then we're complete.
And we could do multiple areas at once, right? Like we're doing today on her. What are we doing?
Yep. So she was inner thighs,
Mm-hmm.
and then also that buffalo hump we're working on right now. So it's very common for us to combine areas in one session.
Awesome. Awesome. Let's see if we have any more questions.
Yes, the last question that I had was about the scars. Our scars are very, very minimal, about the size of a freckle. So really no scarring, which is another amazing thing about our procedure. You get great results with really almost no scar, like I said, the size of a freckle. So check us out, look at our Instagram. We're so glad you guys joined. Thank you so much here in Denver, and we will see you again soon. Bye.